to reporters who are putting their outlets in the chat. That's really helpful. Okay. I'm going to begin. So, good morning, everyone. Welcome to today's American Community Media Weekly National Briefing. I'm Sunita Sarabji, your moderator today and co-producer of our weekly Friday briefings with my colleague Pilar Marrero. The declining mental health of children and young adults is what former U.S. Surgeon General Dr. Vivek Murthy calls the crisis of our time. More than 22% of Gen Z young adults reported having a major depressive episode in 2023, according to data from the National Institute of Mental Health. And 4 out of 10 children report persistent feelings of sadness. Varying ethnic groups have varying levels of depression and anxiety, and Latino and Black youth report some of the highest concentrations of both. Speakers this week will discuss the many drivers of poor mental health in children and young adults, including poverty, racism, rejection, incarceration, and the many uncertainties of contemporary American life. They will also discuss the stigmas surrounding treatment and the lack of culturally appropriate care. As we have noted in previous briefings, fewer than 6% of mental health professionals are people of color. So we are so pleased to welcome today Dr. Kiara Alvarez, Bloomberg Assistant Professor of American Health, Department of Health, Behavior and Society at Johns Hopkins Bloomberg School of Public Health, and joint appointment at the Department of Psychiatry and Behavioral Sciences at Johns Hopkins School of Medicine. Victoria Birch, who is an advisory board member for the California State Office of Youth and Community Restoration and a volunteer at Beloved Village, which she will tell you more about when she speaks. Sujin Lee, LMFT, a therapist and director of the Yellow Chair Collective. Dr. Osana LeFer, research assistant professor in the Department of Psychology and licensed clinical psychologist in the Child and Adolescent Fear and Anxiety Treatment Program at the Center for Anxiety and Related Disorders at Boston University. We asked panelists to speak slowly for our interpreters in Spanish, Mandarin, and Korean. We asked reporters to enter their questions in the chat. Our speakers are also encouraged to answer the questions in the chat after they present. We will send a video of today's briefing and expanded bios with contact information for each speaker to all participants later today, and we will proceed to Q&A immediately after each speaker presents. Later this afternoon, I mentioned that. So let's begin. Our first speaker today is Dr. Osana LeFer, who will discuss the multitude of challenges Gen Zers are navigating and their impacts to their mental health. Dr. LeFer will also discuss novel treatment options. Welcome, Dr. LeFer.
Thank you very much. It is a pleasure to be here with everybody. And as Sunita said, since the early 2010s, we have witnessed a steep and troubling rise in mental health issues amongst young people. Anxiety, depression, attention deficit hyperactivity disorder, and behavioral challenges have all become significantly more common. In October 2021, just months into the pandemic, leading organizations, including the American Academy of Pediatrics, declared a national emergency in children's mental health. But here's the thing, even before the start of the COVID-19 pandemic, the situation was worsening. According to the U.S. Department of Health and Human Services, the number of high school students reporting persistent sadness or hopelessness rose 40% between 2009 and 2019, which is to more than 1 in 3 students. And this crisis is not caused by one single factor. it is in a way a perfect storm coming together. And some of the things that have been driving it have been the increase in social media and smartphone use, which has led to constant online comparison, cyberbullying, fear of missing out, and studies. And in addition to this, where now children and young people constantly have the ability to know who's doing what, where, what they're not participating in, receiving this constant feedback on what they're doing and not doing. And studies, in addition to this, studies have consistently linked higher screen time to anxiety, depression, and disrupted sleep. Another factor that has been contributing greatly to this crisis is the increased academic and social pressures, where college admission competition is rising, which in turn is increasing competition in all academic activities, in all extracurricular activities. Expectations are higher. And again, children and adolescents have less time for free play, for enjoyment of their day-to-day life. This increased competition is leading to more intensified parental pressure. And again, this academic and social dynamics are made worse by the digital life, where again, you always know who's doing what and how. Then add to this the COVID-19 pandemic impact, where we had this unprecedented isolation, school closures, disruption of routines, and of course, increased family stress for our young people. And worldwide, and this impact was seen worldwide, where all over the world, studies have shown that there has been increase in anxiety and depression in children post-pandemic. And mental health hospitalizations spiked, especially for girls in kind of preteen age range. These days, and again, some of this is in part related to a pandemic, some of this is related to just the general world situation. Families are increasingly facing economic instability, housing insecurity. Because of some of these things, and again, post-pandemic, parental mental illness is on the rise. And of course, issues like climate anxiety and global conflict are on everyone's radar, on the children's and youth radar more than ever. However, I should also say that some of this increase that we're noticing has also been a reflection of better detection of problems, not just worsening conditions. And nowadays, and there is this morsel of good news in this, that we have now better screening tools. We have now somewhat reduced stigma around discussing mental health, and we're able to have more open conversations about it. So this is a little bit of good news in this increased rates. So yes, the numbers are very serious and the causes are complex, but there is one piece of good news. There are treatments out there that work. And I want to talk a little bit about that today also. The treatment that has been the gold standard, that has been considered the gold standard treatment for anxiety and depression, is cognitive behavioral therapy, or CBT for short. It is a structured, skill-based form of psychotherapy that helps youth and adults, for that matter, to recognize and challenge unhelpful thoughts and replace them with kind of more adaptive thoughts. It also does not just target the thinking, it also targets behavior, that by encouraging people to engage in behaviors opposite of their negative emotional experiences. For example, for youth with depression, it encourages them to re-engage. It encourages children and adolescents and young adults to re-engage with activities that they have stopped enjoying, to re-engage with activities that promote sense of mastery and accomplishment. For anxiety, it uses this idea of gradual exposure to fierce situations to build resilience and confidence in their ability to handle these anxiety-provoking situations. And the reason I mentioned earlier, it's considered the gold standard. The reason why it's considered the gold standard is because there has been decades of research showing the effectiveness of cognitive behavioral therapy. It has shown that 60 to 80% of young people with anxiety improve significantly with CBT. For depression, rates are a little lower again, but still we see moderate to strong effects, often matching the the effects of medication. And also, one thing we do know about CBT that it has lower relapse rates than medication, and it really teaches lifelong coping skills. CBT again is short term, as I said, it's somewhere an average of maybe about 16 sessions. So it's not lifelong therapy. It can be done in clinics, in schools, hospitals, and increasingly we've been working on bringing it online. So bringing care in efforts to bringing care to people in remote and underserved areas. And again, it's truly powerful in that it empowers young people. It gives them tools they can cope. And it really works. Of course, there's a caveat in this. I'll say this also because CBT requires trained providers, engaged youth and families, and access. And all of those things are things we're struggling with, we're working on these days. But we know when it's available and it's done well, it works better than anything else we currently have. And to make it accessible, we must continue working on expanding digital and telehealth tools, training providers, and bringing CBT where we can into schools, into healthcare settings, and really educate communities, educate families, educate people about it. Thank you. This is all. Thank you.
Dr. LeFer, that was fantastic. Thank you so much. There are a number of questions for you in the chat. What we're going to do is take the first 5 questions and then we'll save the balance of the questions for other speakers. So Laszlo Bartis, would you like to ask your question live or shall I ask it for you?
I'm sorry, maybe much better if you read that because I am ashamed because my English is not perfect. And that's why I would like to ask always if I can in writing, if it's not
That's fine. I'll go ahead and ask your question, Laszlo. Thank you so much. So Laszlo asks, social media has also been negatively influencing the mental health crisis among youth. But according to the news, the rise of artificial intelligence can make this even worse, giving specific advice on self-harm. And yes, Laszlo, you're absolutely right. Yesterday, there was a piece in the Washington Post about a fellow who had been advised on how to commit suicide via AI. Dr. LeFer, what can be done about this?
This is a great question. I think while we're still, I think everyone, community researchers, everyone's trying to grapple with AI and understand what the future, what we do with it, where this goes. I think for right now, so everything shows to, again, really controlling screen use, controlling sort of limiting screen time, limiting screen use, and really monitoring young people's use of screens as much as possible.
Thank you. Nicole Chang, would you like to ask your question?
Yes. Yeah, I'd love to ask a question. Thank you so much. Give me an opportunity. There has been many discussion about the sense of isolation among adolescents, youth, following after COVID-19. And then I'd like to know what is most effective solution and why still this is the continuing the problem.
Why isolation continues to be a problem even after the pandemic.
Right, and also there was a lot of solution came up, and what was the best effective way to solve this problem according to your study or data or based on experience?
I think, yeah, to be honest, I'm not familiar with the data with studies that have looked on resolving isolation, but I think some of the things we can really do, and I'll go back to some of the kind of cognitive behavioral therapy skills, is again encouraging youth to engage in activities with people, joining things even if they're feeling nervous. So again, acting opposite on the emotion, encouraging. So even if they're engaged in online activities, so encouraging a social interactive component in those activities. Again, maybe having goals, setting goals like volunteering or activities that again involve people, and again making maybe passive screen scrolling, passive screen time contingent upon social interactions at the very least.
We'll take a final question for you from Anjana Nagarajan Bhutani. Anjana, please ask your question.
Thank you. I'm curious whether in your experience or if you've seen data, do Gen Z individuals of different genders experience different types of mental health issues? Basically, is there a noticeable mental health difference based on
gender identity? I think there has been some, to my knowledge, there have been some differences in male, female. I think prevalences may have been slightly different. As I said earlier, like for example, post-COVID, again, hospitalization rates had increased for girls for mental health problems, but not for boys. So I think there's subtle differences like that. But I think largely they are still quite similar in the rates, but maybe in specific types there are differences.
Thank you so much, Dr. LeFer. Please stay around for a final round of questions. And reporters, there are a number of questions that you've asked in the chat. We will make sure that they get addressed by our three other speakers. So our next speaker is Dr. Kiara Alvarez, who will discuss the unique challenges faced by Latino and Black youth. Welcome, Dr. Alvarez.
Hi, thank you all so much for having me. There's so much to cover in this topic. I'm still taking it in to some extent because I think there's a lot of different directions we could go with this. So I will try to cover some elements that I think are important, but certainly taking into account there's a larger story for any of these components. I think Dr. LeFer did such an amazing job of really demonstrating how mental health and the risk for even specific mental health conditions like depression and anxiety or for suicidal behavior, these are very much multifaceted causes. We do have to address things at every level. It's not only the individual level or only the societal level, but it's how those things interact and how they interact in individual people's lives as well. And the goal, I think, is really to think about these broad community level protective factors that we can put in place to lower the risk for everyone or to lower the risk for particular groups. And then also to think about how we get those mental health treatments to the people who most need them. And so it is hard sometimes because there would be ideal if there was one cause that we could really zero in on, but there are multiple things that we have to address at the same time. So I think thinking about some of those statistics, there are certainly some more detailed tables I can share from some of the surveys that are used most commonly. But when we think about these national level surveys about young people, when we're seeing statistics in the news, when we're seeing reports, we're often hearing about the Youth Risk Behavior Survey, which is a survey of youth in schools, which really looks more broadly at mental health symptoms. So it's not a clinical diagnosis was done by a doctor or therapist, but it is looking more broadly at youth symptoms. And then we also have the National Survey on Drug Use and Health, which gets into a little bit more detail about the mental health conditions. So I say that just because sometimes you might hear us talk about different numbers and you might wonder why there's a difference. But in the Youth Risk Behavior Survey, where we ask more generally about youth having the experience of feeling sad or hopeless for at least 2 weeks at a time, enough to interrupt their normal activities, these are symptoms of possible depression, we get very high numbers. In 2023, we've seen over 53% of girls and 28% of boys having that experience in the past year of feeling sad and hopeless for 2 weeks in a row. And highly concerning to think that half of girls right now are having that experience in high school. And we do see some differences by race and ethnicity. That has changed a little bit year to year. But right now, when we see that breakdown by ethnicity, we see Indigenous youth with the highest rates, 45%, and Latinos just behind at 42%. But it's fairly similar. We still see rates around 40% for multiracial youth, Black youth, and white youth. And one thing to note is that we do miss some things in these comparisons because there is so much diversity, even in broad categories within these groups. Latino, Asian, all of these terms really obscure very different nationalities, cultures, socioeconomic status, other impacts. And we do have, I think, good evidence to show that when youth have multiple marginalized identities, so youth who are LGBTQ plus and also identify with a minoritized group, they tend to have very high rates, unfortunately, which we really can link to the experience in society of being part of multiple groups that are being marginalized and are being mistreated. I know there was a question about gender differences, so you heard about that. Gender differences in depression, we often see these high rates among girls in adolescence. And we do see that for suicide. There is what we think of as a little bit of a gender paradox, where you tend to see higher rates of suicide thoughts and attempts among girls, but we see higher rates of suicide deaths among boys. And that carries out across most racial ethnic groups, and it's partly thought to have to do also with boys using more lethal methods in a suicide attempt. So there are, again, different, more specific details we could get into, but one thing to note is that over time we have seen that gender gap grow smaller, and unfortunately in the wrong direction, where we're seeing suicide deaths go up for girls. We're seeing suicide deaths go up for racial ethnic groups that used to have lower rates. And so we are seeing this concerning trend of increases in deaths. And when we think about suicide prevention, again, we think about a variety of different causes and a variety of different ways to intervene, because the other piece that is pretty important to think about is just the fact that many people who attempt suicide or die by suicide don't necessarily have a mental health condition. And so it's not the case that only by treating depression or only by treating anxiety you address suicide, because it actually is associated with a lot of different conditions and experiences. And it is thought that some of what we've missed for Latino and Black youth is other causes besides mental health conditions that are leading to suicide attempts and suicide deaths. So one part that I will touch on just to say is that we can talk about disparities in terms of the amount of people with a condition, but the trend that we see that's really concerning has persisted over time is the disparities in the US in access to mental health care. And so we really see very consistently over multiple decades that Black, Latino, Asian, and Indigenous youth have less access to mental health care than white youth. And this is even at the same level of need. So you're looking at a situation where there's the same condition or the same severity of condition, and you see much lower access to mental health care. This is in a context, I would say, where access to mental health care overall in the US, it's not good for anyone, right? We have a lot of problems with getting people access to mental health care, but we also see those racial disparities. And part of what that's led to is we do have research and evidence showing that for Black and Latino youth, Black and Latino adults, you can get to higher levels of severity of those mental health conditions because of the lack of treatment. So there are a number of structural barriers within our mental health care system generally. We know that there's a lot of challenges in accessing mental health care. There's workforce shortages, there's insurance issues. But again, we know these issues are not evenly distributed. And so some of the challenges for Latino youth, for example, is among youth under 18, you've got the highest rates of uninsurance or underinsurance for Latino youth. You have barriers for Latinos and other immigrant groups such that if the parents speak a language other than English, it's harder to get a usual source of care, to find a therapist to work with you and to be able to involve you in treatment, which is very important for young people to have families involved in treatment. So there are multiple barriers that persist. And one of the areas that we've focused on in my research group around is having to do with the impact of structural racism on these systems, and just the notion that what we're seeing really is that funneling youth of color, funneling Black, Latino youth into systems that are punitive. And so youth are more likely to get into kind of a behavioral referral at school, a disciplinary referral, to be treated within the child welfare system or the juvenile justice system, rather than getting that kind of specialty mental health care that they need in settings that are supportive. And we see as well that at the level of families, and I think I saw this in the chat, there's a huge amount of concern about what happens if you go to seek mental health services and you're already part of a group that's marginalized, where there's a risk for the involvement of child protective services or a risk for immigration enforcement and other challenges. And so we see that intersection where the services are both not available to people, and also if you do have a way to get to the services, there's a lot of reasons to avoid them. And so we have a multi-layered set of barriers that need to be addressed. I do want to make sure I stop to leave time for questions, but I think that what I would say is that taking the perspective that we start from community, that we start from building up the ways in which community organizations already have those roots in a community, and combining that with the evidence-based practices for mental health that we have on the research side, and thinking about ways to get those collaborations together to move things into communities. A lot of the work that people are doing now in terms of community health workers for mental health, which is one of the areas I work in, but a lot of other good work as well being done around peer support, youth-led initiatives, and things that we can do to really transform the mental health system from outside of the mental health system in the places where people already are and where those trusted relationships are already established.
Thank you so much, Dr. Alvarez. A number of reporters are asking the similar versions of this question by Nora Estrada, who asks, let me see if I can find her question. What is the impact of immigration measures such as mass and often violent raids and detentions?
Yep. Yeah. So I will answer that question. I will also say that I can put some things and some resources in the chat for, I think, some groups that have done a good job summarizing this. Absolutely. I think we take as a very baseline assumption that any level of separation of a child from their parent, any kind of large-scale law enforcement raids and experiences in a community are bad for child development. We take it as a baseline that these things should never happen to children. And the research that we have on immigration raids in the past, it has been largely, if we think about, there's a gap, right? Because it takes a little bit of time for the research to be conducted. And the research we have is largely on large-scale workforce raids, which are something that have gone on for quite a long time. And yeah, the impact on communities is very profound. And there's a number of different pathways by which that happens. But there is the trauma of the experience itself in the moment. And then there's all of the things that does to the community ties, to the loss of key members in the community, to the financial impacts, all of the components that really resonate out from that. But the notion that these are traumatic events for children, and that even if you're not there physically experiencing it, but you're witnessing it via social media or via another part of the country, that there are reverberating impacts on communities on that climate of fear.
Thank you. Nestor Fantini, could you please ask your question?
Yes, of course. Yeah. So Nestor Fantini from Hispanic LA, and Dr. Alvarez, in many ways, you already answered part of my question, but let me ask it anyway. So the big and beautiful act is going to cut funds to healthcare institutions in a dramatic way. So how is poverty? And of course, the systematic racism that we have if we were to add another important variable, how is poverty and racism contributing to the increased rates of depression and anxiety among Latino and Black youth? And the most important thing, what can public health institutions do differently to address these root causes given the budgeted challenges that they're going to face, especially as of the next fiscal year?
Thank you, Nestor.
Yeah, thank you for that question.
Thank you.
Yes, absolutely. You're absolutely right. And when we talk about structural racism and poverty, it's interlinked because one of the mechanisms by which we uphold these divisions. And absolutely, the idea that economic policy, that bringing youth out of poverty, bringing families out of poverty reduces that toxic stress on the family. We have a lot of good evidence now to show that long-term toxic stress that's caused for youth by living in conditions of poverty, and for families. Dr. LeFer mentioned the impact on parental mental health. And so we know that suicide rates, for example, go up in times of unemployment, times of great societal upheaval. There's a lot of concerns for that. And again, we're talking at a population level, so it's not to say that everyone in that context is experiencing a mental health condition, but that it does increase the risk, and it also increases the difficulty of being able to seek out services when you need them, or even being able to prioritize those services because you are in a situation of needing to survive, needing to put your attention and energy towards providing for a family, for example. And so it's much harder to then say, okay, on top of that, we're also going to seek out mental health services. We're going to find a way to pay for this. We're going to have the insurance coverage necessary. So there are a lot of levels that it impacts. And unfortunately, I think we do have some ways that there have been at the policy level, ways that we've found solutions. There's Medicaid waivers that have experimented with different ways to get services out to families. And I share your concern that without those solutions that we know can work being implemented at a large scale, and in fact, with reductions potentially in cost, it is going to have a large impact. And so I think agencies are in the position that I think they have been in for a long time of trying to do more with less, trying to address a greater level of crisis with fewer resources. And it is going to be a major challenge.
And Vargas asked a similar question. If you're a low-income, undocumented parent of a kid struggling with mental health, where do you go for help in a way that neither the parents nor the child will be exposed to immigration-related issues? And does this vary among jurisdictions and states?
Yeah, I think it's important for people to know that help is out there, right? And that from the perspective of health, that they still have, their rights are still protected with regards to protected health information, with regards to even private areas of clinics, for example. But certainly there are real concerns. And so from the perspective of policy, in terms of sharing that information, that's not information that's supposed to be collected or shared. But certainly, I think it is important to get to know the resources in one's own community, as to know which agencies, which providers really have an understanding of the context right now and which can really serve them. And I think there are really amazing networks across the country. So we also do want to make sure that people know that help is out there and don't feel discouraged from seeking help because they've heard that the mental health system is part of this. I think we have to be cautious about where we refer to, but certainly as a general sense of policy, mental health and healthcare systems are there to serve all of us.
Thank you, Dr. Alvarez. Dr. LeFer and Dr. Alvarez, there are so many questions for both of you in the chat, and if you could take some of those on, that would be terrific. So our next speaker is Sujin Lee from the Yellow Chair Collective. Sujin will discuss challenges faced by AAPI youth, the stigma surrounding poor mental health in that community, and the lack of culturally appropriate support. Welcome, Sujin. Welcome back, I should say.
Thank you. Thank you so much. Hello, everyone. Thank you so much for having me again. My name is Sujin Lee. I'm a licensed therapist and the co-director of two mental health organizations, Yellow Chair Collective and Entwine Community. We focus on culturally responsive care for Asian Americans specifically and multicultural communities. I also wanted to preface this by saying that I am a practitioner and not a researcher, and that I come from a lens of being a Korean American immigrant myself. And so these are my own identities, which informs my work and the community that I am also part of. We work with youth and young adults, especially those navigating the complexities of intergenerational trauma, cultural identity, and stigma that still surrounds the mental health in our communities. I will try to speak a little bit slower. I think I was told to speak a little slower for the translators. Okay. We know that Gen Z is in the middle of mental health crisis, and Sunita, you have also reported on this, but according to SAMHSA, that about 22% of young adults ages 18 to 25 are experienced major depressive episode in 2023. And then the Harvard Graduate School of Education study found that over 34% of young adults report feeling lonely frequently or almost all the time. The way that I see it as a practitioner is that loneliness isn't just about being alone, that it's actually about being unseen or being misunderstood. Many youth are carrying a mix of academic pressures, economic anxiety, and constant identity comparison shaped by the social media. And even though they're told to be authentic, quote unquote, they're also constantly expected to perform on social media and in classrooms and even at home as well. Systematic racism, whether through underrepresentation, discrimination, or invisibility in education, media, and healthcare, play a very major role in the rising rates of depression and anxiety amongst the AAPI youth. When young people grow up rarely seeing themselves reflected and only being seen through specific types of stereotypes, it sends a message that they don't fully belong in any of these spaces. For Asian American youth, all of this is compounded also by the cultural stigma around mental health. And it's a very real weight, which also carries through intergenerational stigma around model minority myth. According to the CDC, Asian Americans are least likely to access mental health care amongst all racial and ethnic groups. So many of us are raised to avoid burdening others. It's a part of a core belief that a lot of Asian American family dynamics still carry. And we're taught that sharing emotional struggle is a weakness, and sometimes even viewed as a sense of failure within the entire family households. So the model minority myth also adds to that narrative and telling us that always being successful, composed, or to never make a noise, right? And so to internalize all of these messages, youth are being told that there is no room for them to be able to express their sadness, anxiety, or any kind of vulnerability at all. So when a young person is struggling with depression or panic, like a sense of anxiety, they often don't think I need help. What they're actually thinking is something is wrong with me, and I need to figure this out on my own. And then the part that covers a lot of the context in which of our upbringing and narratives, to me, has a lot to do with what we call intergenerational trauma. And intergenerational trauma, simply put, is an emotional or psychological pain that is being passed down from one generation to the next. It's often rooted in experiences for especially a lot of the AAPI community members like war, displacement, colonization, and systematic oppression. It can shape how families communicate, express love or lack thereof, and cope with stress. Even if those original events, and this is a key part, that some of these war stories are not exactly openly discussed in the family dynamics. And yet, those traumatic events are still being passed down through generations. Many of our youth are being raised by parents or grandparents who have lived through war, displacement, poverty, and colonization. And that kind of trauma doesn't disappear. It gets passed down through a lot of silences, but also through expectations. And a lot of them do get passed down through academic pressures, perfectionism, and even the way that love is being communicated. So for example, I work with a lot of youth who desire for their parents to be able to tell them, I love you, verbalizing that love. But in a lot of parents' perspective, that the way that they want to express love and emotional affirmation is just through taking care of them financially, finding stability, or even pressuring them to find that financial success. There's a clear emotional language gap, which creates a lot of disconnection. And so, of course, on a societal level, with social media and all of these narratives are being internalized for them, that they don't have a sense of belonging, but then even within their own home, that they feel that disconnect as well. There is also this part that I hear a lot, this emotional expressions that I hear a lot with the youth, which is guilt. Very oftentimes, because of the intergenerational trauma and the stories and the context in which that they hear from their parents or grandparents or just from school and social media, a lot of them will diminish their sadness by saying things like, how can I be sad when my parents have given up so much for them? Or that their parents have gone through so much in their lifetime that their pain does not equate to that level of pain. And so they will diminish their pain. Now, I know that Dr. Alvarez has covered a lot of this as well. And when AAPI youth also reach out for help, that they often encounter therapists who don't fully understand their cultural background as well. Only about 3% of the US psychologists identify as Asian, according to the American Psychological Association. And unfortunately, the lack of cultural understanding can lead to even well-meaning providers to unintentionally cause harm. For example, I hear this very often for a lot of clients that I've seen other clinicians and come to us as Asian identifying and culturally responsive care in saying, I've seen a therapist and they've told me that I need to cut my parents out of my life because they are harming them in one way or another. Yes, that can be a fact and it's true. However, it really does a disservice because they don't fully understand the importance of things like filial piety or like mislabeling of loyalty, family loyalty, and the importance of that within our culture. And they're labeling that as codependency, which may be true in some manner, but also having that context and understanding of the importance of what it actually means for this individual in our community is very important for the providers. So for us, culturally responsive care is very important. And one of the things that is very important to us when we work with individuals is also community care. And so for family inclusive therapy and trying to invite as many family members as possible into the individual care is very important to us. Having as many bilingual services are very important to us, as well as creating a lot of peer support spaces are very important to us as well. We are very proud of one of the things that we provide once a year, which is an Entwine retreat. It's a wellness retreat, which is very much grounded in being able to balance our identity and heritage together. And so we bring together a lot of Asian American therapists, healers, and community members for a weekend of rest and reconnections. And we host things like sound bath, and occupational therapists are able to have sensory oriented things and movement therapy sessions, as well as storytelling circles. And we have movement oriented practices that are really embedded into our intergenerational cultures, like Tai Chi, that is also being introduced to our youth as well. And so in these ways, we might not explicitly be talking about mental health, but that we're actually allowing them to experience what it means to take care of themselves and for them to feel seen and heard amongst their actual family members and the family dynamics. And so these are some of the
Thank you. We want to save time.
Yes,
and,
absolutely.
There are a number of questions for you in the chat, and excellent remarks. I hope you address the questions that are directed your way in the chat. We move on to Victoria Birch, who will share her personal story and overcoming her challenges with the support of the organization Beloved Village. Welcome, Vicki.
Hi, my name is Victoria Birch. I work with the Office of Youth and Community Restoration Youth Advisory Board, but I'm here on behalf of Beloved Village, which has supported me a lot throughout a very big transition in my life. I have personally struggled with anxiety, depression, and a lot of mental health illnesses and like disorders. Since elementary school, I was diagnosed. I think one of the biggest mental health struggles that I dealt with was when I was getting into like my teenage years. I struggled a lot with depression, anxiety, self-harm. And my mom, she was raising 4 kids by herself, learning how to deal with her own mental health problems and trying to take care of all of us. But at that point in my life, like my mom was not able to handle me as well as her other 3 kids. So I ended up being placed in the foster care system in order to try to get like more support that I needed. But at that point in my life, it didn't really feel like support. It felt a lot more like I was being pushed out. And so that caused a lot more mental health issues for me. Like I struggled severely with depression because I felt like I didn't have a place to belong. I had, like I said, my mom has had 4 other kids. My father has had lots and lots of kids. But out of all, I think I have 13 siblings. Out of all of my siblings, I was the only one who ended up in foster care. So that was a very big mental health toll for me personally. And I was really trying hard to understand my sense of belonging, but dealing with depression and trying to find family ended up getting me into friendships that were not the healthiest, into relationships that were not the healthiest, that created this more negative downward spiral. And eventually I ended up being incarcerated from the ages of 16 to 22. I've only been out for less than a year, but throughout that time, I have had a lot of support from learning how to rebuild a relationship with my mom, but also like with Beloved Village, they've helped me a lot in my transition getting out. And they started working with me about 6 months prior to my release date, and they helped me learn how to reach out to therapists and reach out and like connect with people. They also taught me like not all people are only there for the money, because that was a big thing that I felt that I had learned while I was in multiple systems. Is like a lot of people were there for money, but not a lot of people were there for the youth. And so with Beloved, they were really genuinely there for me. Not too long ago, probably 4 months ago, I had been going through a very toxic and unhealthy relationship that had caused me to spiral into a very deep depression. And they had been a solid rock in supporting me and making sure that everything that I needed to try and get into a better, safer place mentally, physically, they did everything that they could. They reached out and they were like, look, I know you don't want to talk, but I know you need to talk. They were like, I'm not going to make you do it right now, but I just need you to know I'm here. And so like little things like that had really helped me realize like, people are reaching out when they see me struggling, even if I don't ask for help. And that's a really big thing for me. Like I got a lot of support through them, whether that was like they just called and they seen because they were like, you know what, you haven't really checked in a while. And I know this has been going on with you. Things along those lines. But I don't know. I just think that continuing to just support young people. Oh, I just read a quick question. It said, Victoria, have I connected with my mother and my other family members? Actually, yes, my mom is here with me. I've connected with her. I've reconnected with my family members. That has been a really big support with Beloved. They have helped me to reach out to my other siblings on my dad's side, because I actually didn't know them or meet them. So Beloved has helped me reach out to siblings that I haven't met yet. But also, while I was in just working on my own mental health, learning to work on my mental health helped me in my relationship with my mom so much.
Don't worry about the questions yet, Vicky.
Okay,
Just
I'm like,
go on with your, yeah.
okay, so sorry.
No worries. We'll have time for quick Q&A.
I've been able to reconnect with my family, and that has actually been a really big support in my mental health journey, because I live on my own as a 22-year-old who is transitioning at an age where 16 to 22 is a very vital lifetime year where you learn adulting and life skills. And I didn't have those opportunities. And so being able to work on my mental health in order to build my relationship with my mom has actually helped my mental health since my transition, because now I know I have somebody like that's closer than the support that I can call and be like, hey, this is where I'm struggling, or hey, I just want to get out of the house. Are you doing anything? Can I spend some time with you? Because honestly, mental health problems don't go away with age. I think people just learn how to mask them better and cover them. And so I think like building that relationship with my mom has definitely helped me to get past it.
Can you put her on your screen? Is she here?
She's here.
I don't know if you can see it. Hi, it's all weird.
Hi.
Jenny.
Yeah.
Yeah, she came to support because I told her I was doing this and it was exciting. And so she's actually she's probably my biggest fan. She supports me so much.
Yeah. And could we ask you, what was it like to give Vicky up when you had to do that?
No.
How did that impact your own mental health?
Do you want me to do it? You want me to?
Vicky and I were actually just talking earlier, and I shared with her for the first time that like my oldest child passed away, and it was harder for me to make the decision to put her into the system than it was to bury a child, because burying a child you knew it's final. And the reasons that I put her in the system weren't because I didn't care. It was because no matter how I was trying to show love and break generational curses on my side, it's not how she would receive the love. It wasn't her love language. And so I was trying my best to get her to a point where she could feel love and I could still be around. I didn't want to not be around. I just wanted her. As a parent, you want your kids to know love and feel love and be safe. And it was a point where, okay, I wasn't able to provide all of that for her and my other children. And so what can I do to do it? And so it was a lot of prayer and a lot of groups and a lot of heartache and tears on making that decision. And again, it was made because I was hoping that a family would be there that knew how to show her love in a way that she could accept. And then maybe we could work on a relationship. And it's not how it ended up, but our relationship has
substantially
grown. I wish that none of this would have happened, but all at the same time, it's been a blessing that all of this has happened because it's had time for both of us to reflect and take the time and be able to reconnect and really be able to stop and pause and listen, not to respond, but to understand the other person.
Wonderful. That's really wonderful. Vicky, how has it helped your own mental health to reconnect with your mother?
As I was saying earlier, I live by myself. I've lived by myself since I got out of a facility. And so for me, going from constantly, I grew up with 3 siblings. And then after that in the system, I was in group homes. And so I lived with over 10 kids at points. And then I was in the juvenile justice system and I was constantly around people. I was at one point with 50 other females plus staff. So transitioning out onto my own was hard, but having the relationship with my mom to be like, hey, can you come over? It's really weird for me to be by myself. Like, it's a lot. It's overwhelming. Or, hey, how do I make this? Because sometimes, like, even though I'm 22, I don't know how to do everything. I'm learning still, and I don't have my life together yet. It's getting there, but it's not perfectly together. But the fact that I know I can reach out and be like, I don't know how to do this. Can you teach me? Or, hey, what are you doing? Can we just hang out? Or do you want me to come over and just hang out with you and the cats? Or do you want to come hang out with me and my dog or whatever? Or do you want to go to the park or just window shop? Just anything. Like, it really is. And a lot of the times people think that just because somebody's working on their mental health, they always want to talk about it. But learning that, like, being in peace with people is also really positive thing to do for your mental health. Is even if you're not talking or doing anything together and you're just in presence with each other, it helps a lot. And so I think that my relationship with my mom has really helped me get through a lot of tough times this past year, because this past year hasn't been easy.
Yeah.
Are you open to being quoted? And can I give them your name?
Sure.
She's open to being quoted. I will put.
Not expecting.
I can send her name in the chat because the spelling isn't typical.
Yeah, and you've got a lot of thank yous for your generosity and sharing your story. Vicky, could I ask you one last question before we go to a final round of questions to all speakers? For all speakers, you were incarcerated, and before that, you were in foster care. Could you talk a little bit about what the girls that you were with in these situations, what was their mental health like? What were they experiencing?
Nobody had good mental health in any of those circumstances. Imagine, because a lot of the time, the girls that I was in facilities with, they had a lot of struggles outside. And so not everybody was willing to open up, but those that I was able to really connect with, like, life was not easy for a single one of us who was in the system, especially as the young women. And a lot of the times, the decisions that young women made that ended up placing them in the system were more for fear of safety and survival rather than just trying to do something. And so I feel like their mental health was a lot harder because as a woman, a lot of the time when you are placed in a system, you don't reach out for support and help because you got yourself there and now you have to figure it out. That's something that we've been taught our whole life. So a lot of the time, girls struggle with mental health, and there's no other thing other than, like, everybody struggled. Some people struggled a lot more hardly than others. Other people were doing their best to make the best out of it, but everybody struggled. There was nobody who didn't.
Thank you so much to Victoria and Jenny for sharing your stories. We have a question from Alvin Galloway, and let's address that. Victoria and your mother, we appreciate. Oh, it's just a comment. He says, we appreciate you sharing your stories. Thank you for that. And now we're going to go to a 30-second soundbite from each speaker, their most important takeaway from our discussion today. Let's begin with Dr. LeFer. Dr. LeFer, are you still there?
Yes, I'm here. Sorry, I took a second to unmute. I think, so the most important thing I'll say, again, we're facing a huge mental health crisis. Anxiety and depression have doubled in the past decade. Again, everyone I think has said similar numbers. 1 out of 5 kids potentially is affected. But we have hope. There's therapy, that cognitive behavioral therapy, gold standard treatment, evidence-based, skill-focused, and teaches kids how to manage their thoughts and emotions effectively. And I think if we can figure out this better access to it in schools, clinics, online, this can potentially be a game changer for this generation.
Thank you so much. Dr. Alvarez.
Yes, thank you. I'd like to close on adolescence is a time of great upheaval. There's many challenges, and it's also a time of great opportunity of growth. It's a time that's what's so amazing in a young person's life, how much they are learning about the world around them, how flexible in some ways their brains are to be able to respond to the world. And so really taking that strengths-based approach, thinking about youth, thinking about the unique characteristics and skills of Gen Z who have really gone through so much in the last decade, if we really think about the circumstances they've grown up in and have really developed unique skill sets and perspectives on the world. Taking that perspective and merging that with cultural strengths, societal strengths that we have in communities, and doing anything that we can to really support that, to really support the things that are bringing kids a perspective on their future that is positive and that's really supporting in creating that future for them as well, is really, I think, thinking at that level and thinking about the positive and what we can create is where to lead from, as well as to how we support families and parents in this really challenging work that they are doing.
Thank you so much, Dr. Alvarez. Sujin Lee, your final thoughts?
Yeah. For us, mental health care is not just about therapy, it's about community care and incorporating all the ways that healing has already existed in our culture and identity. For example, I have mentioned about how we do sound bath, breath work, or even Tai Chi as an introduction for intergenerational healing. And so there's a lot of ways where nonverbal communication can be a form of also healing methods for all of these different systematic things that we're talking about here today. And so to create a lot more opportunity of these spaces in educational settings and in community spaces where youth already are finding a sense of belonging would be very important. We just want to recognize that youth are navigating a compounded weight of a lot of different sorts of things like racism, family expectations, cultural stigma, and a lot of sense of invisible grief as well. And that healing is not one size fits all. And that we want to be able to have the opportunities for them to tell their stories and to hear their side of the stories as well.
Thank you so much. And Victoria, we conclude with you.
Sorry, I wasn't unmuted. My apologies. I just wanted to say that I think that throughout this whole thing, I think one common topic is mental health is kind of omnipresent. It's everywhere, even when you don't see it. And I think that bringing things back to like cultural healing is a really big thing, like whether it's in indigenous spaces, whether it's like doing like African drums, whether it's doing other things, like just grounding yourself in your ancestry. I think that's a very big part of healing. And I think that's something that needs to really come back to healing. But also like connection is a huge part to supporting people in mental health. Like making them feel connected to you on a deeper level is very important. And I just wanted to thank you guys for having me.
Of course. Thank you so much for taking the time from your busy schedule. To all speakers, thank you so much for an incredibly moving and insightful discussion today.